High-risk behaviors are really common in adolescence, and it's a big part of taking care of adolescents.
While some behaviors might seem a little bit shocking to you, that or me, these are like sort of normal behaviors for some people, and just to normalize it in that sense, it's like, okay, so this person is doing, X, Y, or Z. They're having unprotected sex. They're having sex while using drugs.
But at the same time, I wouldn't downplay it and say, oh yeah, everybody does that, or don't worry about it. You can use those expressions for someone who is embarrassed, doesn't want to share, but for someone who is openly sharing with you, trying to over-identify with them probably is going to be detrimental in the long run. Because at some point, it may become a problem for them, and you don't want to be complicit in them feeling like this was all okay.
And in terms of, what you might say to a person, we really there's only a couple tools that were really taught in medical school. One of them is motivational interviewing, and the other one is the stages of change. So you can use these two tools to help you. And then if you can relate it to something that they care about, like let's say it is someone who's drinking too much. Maybe they have children, and you can ask them, has the drinking ever, impacted your parenting in some way, or impacted your children in some way, for example. And then also to assess where they are in terms of their readiness to change. So you want to find out, well, do you think this is a problem for you, or do you think or do you think this is something that you would want to change in your behavior? And then you can explore why or why not. But then also, and you can push them a little bit about that and try to move them to the next stage. But then also recognize, again, people only do what they're ready, willing, and able to do. And it might take many, many sessions to get them to change.
If you've asked them about it and they're kind of reluctantly or not just telling you what they're doing, then they're probably not in the contemplative stage. But almost any time they bring it up themselves, I would say, even if they're framing it to you as they don't care about it or they don't think it's a problem, if they've brought it up to you, they probably do think that it is a problem on some level. And so then the question is, how do you get them to acknowledge that to you so you can have that conversation? I also think that it's important to remember, especially when working with adolescents, that developmentally, they're very concrete thinkers. So focusing on long-term effects, like lung cancer, should never come up in a conversation about cigarettes. Sorry, maybe in cigarettes, but certainly not in marijuana, because I don't think that people adolescents can't really make those connections about how their behavior now is going to affect the rest of their life or something that's going to happen to them when they're 50. They're just enjoying the moment right now. I think focusing more on short-term effects. So with cigarettes, if somebody has asthma, I think focusing on how this might make their asthma worse, or if they're having breathing problems, or if they're there for frequent URIs or sinus infections, focusing on the concrete right now is going to get you much farther in moving them from pre-contemplative to contemplative than long-term effects. With marijuana, the thing that I've found the most success with is helping people to make the connection between poor academic performance or lack of motivation to do things or depression and marijuana use. The other thing that you'll sometimes confront in certain populations is people using drugs as a way of treating mental illness. And I think in those situations, it can be hard for people who are using the head screening tool. You get to drugs before you get to emotional health. So sometimes you don't know that this is a problem when you're actually asking the drug questions, but sometimes looping back, if someone reports that they're feeling depressed on a regular basis or feeling anxious, and so they're using drugs, to loop back and say, do you think that you're using marijuana as a way of treating that? And then offering them an alternative can sometimes be a helpful approach.